Hi friends, welcome everybody, and you're watching PhysioFacts and myself Dr. Alphonse Abrusami. Today we are going to see a small video on fracture healing. Fracture healing can be explained in 4 stages. There are some textbooks telling 5th stage also, but we'll stick on to only 4 stages. That's what I'm going to explain today. Stage 1 is stage of hematoma, stage 2 is stage of granulation tissue, stage 3 is stage of callus formation, 4th stage is stage of remodeling. Let's see what happens in each stage following fracture. Yes, there is a fracture. From now onwards, the process of hematoma is started. It will extend up to 7 days. Yes, the hematoma will be formed around the fracture as well as between the fracture fragments. The blood supply has to go to the target cells, but because of this leakage of blood from the soft tissues around it, or the striping off of the periosteum, the covering of the bone gets striped off because of the fracture, so this hematoma is happening. Now the cells around the fracture sites are not getting enough blood supply because it is leaking out. What happened? These cells will go for ischemic necrosis. Ischemic means because of the reduced blood supply, they are going into a process called cell death. But all the cells not getting going for this ischemic necrosis, but few cells will get differentiate into a daughter cell. It will differentiate into another cell of its own by a process called mitosis. It is nice to see, right? Because many cells are dying in this tough situation, but certain cells are becoming into a new cell through the process called mitosis. This is a key process that initiates the healing of fracture. What happens next? Then comes the granulation tissue formation. From this hematoma, the cells will differentiate into granulation tissue. What is a granulation tissue? It means the tissue cell that possesses blood vessels, fibroblast, osteoblast, all the immature cells, in the sense tenoblast, all that. What happens? A cell that is having blood supply, that can develop into a fibrous tissue, that can develop into osteocyte, is called granulation tissue, because it gives provisions for that cell to develop into another matured cell. Anything it is not mature, a previous state of the mature stage is called blast. So fibroblast become into a tissue becoming into one fibrous tissue. His previous stage is called fibroblast. A cell becoming into a osteocyte. Before that, it will be in a position called osteoblast. So a cell that is possessing these structures are called granulation tissue. Now the fracture is getting fixed by a soft tissue anchorage. Soft tissue anchorage in the sense it is not structurally rigid, but it is getting fixed with a gelatinous tissue like granulation formation. Then comes the third stage. Third stage lasts between 4 weeks to 12 weeks, that is 1 month to 3 months. What happens? This granulation tissue will differentiate, means change into a mesh or matrix of cells. In that matrix, calcium will be deposited. It is slowly getting mineralized. It is slowly becoming harder by the deposition of calcium. That leads to the formation of callus. It is also called oven bone. Oven means again an immature bone. Immature formation means not compact, not oriented properly, not arranged properly. So that is called oven bone. Now this is a first stage that can be seen in the X-rays. Radiologically, evidence of healing can be seen in this stage, in the sense of 4 to 12 weeks. There you can see the callus formation, whitish gazy appearance in the X-ray between the fracture site. By seeing this, the doctor will say that to the patient, you are improving, there is good healing or fracture union. If this white appearance between the fracture site because of callus formation is not seen, the orthopedic doctor may be in a position to tell the healing is not proper, you need to go for some more immobilization or some other management. So this is the stage that can be seen in X-ray. That reveals the healing process. Coming to the fourth stage, you can see the callus is formed there, but it is not in the contour of the long bone. It is bulging. It is not in the shape of the shaft. As the patient resumes his work, getting into his active life of living, he may be walking, he may be involved in sports, that weight-bearing forces will make this big callus into like in the form of an original bone, which we call as consolidation. Now the bone has taken its form. The fracture is now looking like a normal bone almost because of weight bearing and the consolidation of the oven bone. Here the oven bone is converted into a laminar bone, which is well arranged according to the direction of the transmission of the weight through this bone. So how long it will take? It will take 1 year to 4 years long, maybe more, because small changes will be keep happening every time when they are involved in the weight bearing activity. So this is all about fracture healing, which involves 4 stages: stage of hematoma, stage of granulation, stage of callus formation, and the 4th stage, the stage of remodeling. I hope this video would have helped to understand about fracture healing in a simplified way. And this is Dr. Alphonse Aguruswamy signing off. If you like this video, please share and subscribe my channel. Thank you.